I did my AT talk on focused ultrasound and how it can be used to target tissues in the body non-invasively. So it was first thought about by a doctor who was a neurosurgeon. His name was Lars Laskell, and he was the first one that thought about doing this procedure, but the ultrasound technology was not far enough developed yet. And he actually was the one that created the gamma knife procedure, which is like how they do traditional brain surgeries now, but that's like very invasive. So how it works is the that needs to be treated, whether it's in the brain or just in the body. And then the ultrasound beams are focused into the point that they do want to target, and then through heat they're used to destroy the targeted tissues. And they use an MRI to guide the treatments so that they can see exactly what tissues they are targeting, as well as monitor the heat aspect of the procedure. So these are the 4 clinical applications that they are doing so far, and they are neurosurgery, women's health, oncology, and urology. So the first one, the neurosurgery, this was an older gentleman that had an essential tremor, and he came and wanted to get this procedure done, and that was his handwriting right before the treatment. It's very hard to read. His tremor is actually really bad. He couldn't really feed himself anymore. He was very dependent on his wife, and so his doctor went in, made his parameters, targeted the tissue he decided he wanted to target, and that was his handwriting. I think they said 5 minutes right after his procedure. It's very legible. It's much more neater. His wife was hysterical. Was oh my gosh, she doesn't have this tremor anymore. This is amazing, whatever. The next topic is women's health. So uterine fibroids are a big issue with women's health. And there was a lady, she was younger, she was 25, didn't have any kids yet, and had a uterine fibroid that was the size of a grapefruit. So she didn't really have any options really except to remove her entire uterus, and she was I don't want to do that, I'm so young, whatever. So she held off on the procedure, and then she heard about the studies that they were doing with this focused ultrasound, and she went in and applied for it, and they approved her, and they ended up removing the entire fibroid, didn't target any other tissues, and she ended up having a kid 2 years later. The next topic is oncology. So this is a big one. It can be used to treat cancerous as well as benign bone tumors. So it can be used for the cancer treatment as well as just for pain control. And there's lots of really great things with this. First of all, there's no chemo, there's no radiation, so that whole being very ill and all of that is not a factor. There's also an economic value to it because you're not in the hospital for months. This can be done as an outpatient procedure. This was one of the main things that they're really looking into is using this focused ultrasound with cancer treatments. They have not done it yet, progressed it as far as to go into lung cancer or any other cancers that are actually in organs yet. The next one is urology. So they can use the focused ultrasound to target prostate cancer without messing up any of the relative tissues or any of the nerve bundles or anything like that. They said that they can target within 1 millimeter of the area that they're trying to treat. So that's really great because when you get in areas like that, lots of touchy subjects, you can target what you need to target and not damage any of the surrounding tissues. So how this relates to athletic training, the uterine fibroids can occur in women as early as their 20s. So, that's athletes' age range that we work with. Those are college athletes. And then also, most of the osteosarcoma cases occur in children and young adults, ages 10 to 30, which is also, the athletic population. I've actually worked with an athlete that did have a type of cancer, and this was not an option for him. He had multiple surgeries. So this is something that with further research and further approval that we could use to help target certain cancers non-invasively and get our athletes back in a quicker playing time.